NEET DM 2026. So many aspirants, after having done MD medicine, aspire for having DM after their name. And there are so many DM super specialities, and there's a lot of competition among the aspirants for the DM posts. Now, as far as NEET DM is concerned, we are well aware that it is a challenge. So many students appearing, so much of a competition is already set, and I have come up with a precise, concise book on NEET DM, the Platinum Pearls, and Volume 1 and Volume 2. Now, why these two volumes? Because of the fact that we have got uh, so many subjects. I mean to say, the DM is a composite examination, and you are asked questions from general medicine, you are asked questions from hematology, nephrology, medical oncology, cardiology, pulmonary medicine. Uh, and so many branches other than that, like neurology, like nephrology, like clinical hematology, like a party from genetics and clinical pharmacology. So, a student who has to prepare for DM examinations needs to have a good fundamental knowledge of general medicine. And that's why I have placed a large chunk of questions from general medicine into this book. It is just that a book should be student friendly, it should be result oriented, it should be high yield, it should have the previous year's questions, it should have the capacity of an examiner to know what would be asked ahead as well. And what's important from a medicine viewpoint is that medicine is one branch of science which goes rapid developments, the recent changes, the recent advances are there, and one cannot have the luxury to be outdated. You have to be updated with the knowledge, have all the latest drugs, have all the latest developments in the field of medical sciences, be it oncology, be it clinical pharmacology, be it clinical trials, be it FDA approved new drugs, and all has to be there. So, what I've incorporated into this project is all the latest things as well. And the issue is that even if it is the latest book, it tends to be outdated after a few weeks because the pace of medicine is very rapid and things get outdated quickly. So, what I have combined to the max of my ability to give you the latest developments, the recent, and all those things. So, important is that I have combined it because a large chunk of questions is asked from general medicine. And so, we have to have the basic knowledge of genetics, pathology, the general concepts of physiology and medicine, physiological concepts. Many questions are asked from the physiological concepts. That is why this book has, say, done well. And in terms of the feedback from the students, I'm not bothered about the commercial aspect of it. I'm telling you as far as the feedback of the students is concerned, and the time limitations of some MD students who are doing their rotation ships over there in their different I would say hospitals, so they don't have much time at their disposal. So that's why this concise two-volume book in which gives a gist of how to prepare for the DM examinations. So that is about it. And now what is important from a perspective of a physician is that we have to have an effective time strategy, and you have to have a target, you have to have an effective time strategy, when to study and how to study. So you have to have a balance of the things, when to start. You should give at least to yourself 5 to 6 months time to study for the DM super specialty examinations. And if you have there are some branches like the endocrinology, like the gastroenterology, which are very, I mean to say, which are very competitive in comparison to branches like virology, genetics, which have got lesser number of students which want these branches, though the scope is widening for every branch. So important point is that we have to have an impact on how to study. So the time frames should be very, I mean, say, calculated. You cannot start too late. You have to give consistency, a constant time to these things. You cannot give a large portion with the a break and have not studied much. It evaporates. It evaporates just like ether. So you have to be diligent. You have to be consistent as far as DM is concerned. DM is quite different from MCH. So DM students have to be well oriented and grab these basic concepts of genetics, pathology, the underlying chromosomal aberrations wheresoever they exist, the basic pathophysiology of the mechanism of the disease. It's not only about the cases, how a patient presents. It is not only about the clinical features. So that is why I have given in the latest drugs, the side effects of the drugs from a pharmacological perspective, the new developments, the new drugs which have been developed in conditions like the any oncological tumors, GIST tumors, the latest, I mean, say, protocols for chemotherapy, the latest combination of chemotherapeutic drugs, the latest side effects, and all those things. So, to wind it up, I mean to say that this adventure of mine for DM students has got a good response, and I wish that the future editions of my project will help you better. And this is the way how you prepare. This is the way how you, I mean, say, uh, do go for the super specialty exams, and you have to have a basic knowledge. That's very important. Your fundamental knowledge of your MBBS and your MD will help you a lot, but that is not sufficient for DM preparation. You have to go a step higher, and some futuristic trends are asked from you. That's why the super specialty examinations. So my DM pearls, platinum pearls will I hope that it will help you a lot in preparation of your DM examinations. And I have just given you a brief summary of what I have put in this book and why it is important for DM aspirants. So I wish all the aspirants the branch of their choice. I wish them good luck in their academic adventures. Thanks a lot.